Good afternoon, and thank you for joining us for our weekly update. I'm very pleased, as always, to be joined by Dr. Lawrence Loh, our Chief Medical Officer of Health, as well as Tim Beckett, for the final time, our Chief and our Director of Emergency Management, our Fire Chief, rather. I'm guessing some of you are a little tired today. I know I am. I was up pretty late last night watching the U.S. election results come in. What a nail biter. I really hope we get some clarity today, a definitive answer on a winner. Hope it sometime very soon. I'm not sure any of us can take any more of this drama. But before I provide my update, I do want to take a moment and express my deepest sympathies to the victims of the tragic terrorist attack that took place earlier this week in Vienna, Austria. Our thoughts are with everyone affected by this terrible tragedy. Mississauga stands in solidarity with the people of Vienna in condemning this act of terrorism. I also want to say a few words about my good friend and colleague, Chief Tim Beckett. This will be the Chief's last time joining us for our weekly update. Chief Beckett has made the decision to retire from Mississauga Fire and Emergency Services after more than 6 years at the helm. I've had the chance to work closely with him, and we've certainly been through a lot together, Chief. From dealing with serious tragedies like the Hickory explosion, to taking part in community initiatives like the food drives, the Canada 150 celebrations, of course Canada Days each and every year, and we're recently working on the city's response to COVID-19. With him stepping up and taking charge as the manager of our Emergency Operations Centre, he's helped build Mississauga Fire and Emergency Services and position our city as a leader in fire and emergency management right across the country. You've been a calming and trusted voice, even in these tense situations. Chief Beckett, you will be truly missed. Thank you. Congratulations on this well-deserved retirement, and best of luck on all your future endeavors. Many of you may already know that the province released a new COVID-19 framework yesterday. The new framework outlines 5 distinct categories that regions and municipalities can be placed into, depending on the prevalence of COVID in their community. Each category has specific public health measures that must be followed in various public settings. Beginning on Saturday morning, Peel region will be moved into what's called the restrict or orange category. This means that indoor dining will be permitted in restaurants and bars, but with significant restrictions in place. It also means that our gyms and fitness centres will be allowed to have indoor classes, also with some restrictions. I've been urging the province over the last several weeks to provide a safe path forward for our small business community to reopen safely. I believe this framework provides us with that direction. I want to thank the Premier and his team for listening and making the decision to allow business to reopen safely in Peel. We have known for quite some time that high rates of transmission were not occurring in our restaurants, our bars, and our gyms. Now, as they move back indoors, it will be incumbent on all business owners and residents to adhere very closely to the rules for indoor dining. For restaurants and bars, the new rules include a limit of 50 people in any establishment at one time, stopping the sale of alcohol at 9 p.m. and closing by 10 p.m., and no more than 4 people seated at a table together at any one time. For indoor fitness and gym classes, restrictions include a maximum of 50 people per facility at one time in all combined spaces, and a maximum of 10 people per room indoors for classes, and a minimum of 3 meters of space between all participants taking part in a fitness class or working out in the gym. I heard from many businesses over the last few weeks who told me just how anxious they were about their futures, that many were on the verge of shutting their doors permanently, struggling to survive and provide for their families. It is my hope that these new changes will help you get back on track so that you can not only survive the pandemic, but also begin to thrive again. But make no mistake, if we receive complaints, we will enforce the rules. There will be no second chances. I'm urging all business owners in the strongest terms possible to follow the provincial rules put in place. Residents should also know that restaurants, bars, and fitness centres are inherently high-risk settings. People are in close contact for extended periods and cannot always mask. So, everyone, business owners and residents, you need to follow the public health guidelines to the T. If our cases get to a point where public health can no longer trace in the community, then our hospitals become the next front in our battle. And we've seen what happens in other countries when hospitals become overwhelmed. Our schools are doing well because people are following the protocols. If our children can do this, there is no excuse why their parents, the adults, can't do as well. What is so important about the new provincial framework is that it provides clarity on what public health indicators will move a region into a new and a different category. Simply put, we now know exactly what level of community transmission will force Peel to have to adopt more stringent measures and what level will allow Peel to further loosen restrictions. The new provincial framework is a big step forward for our small businesses, but I want to caution everyone in the community. Peel region is still in a very precarious situation. COVID cases as a whole continue to rise while remaining stable here in Mississauga, with an average of 234 new COVID cases per day in Peel, and that is 57 new COVID cases in Mississauga per day last week. These continue to be some of the highest numbers we've seen in the region since the onset of the pandemic in March, largely caused by an increase in social gatherings during the Thanksgiving long weekend. While the picture in Mississauga is not quite as dire as in Peel overall, Dr. Lowe has told me that Peel Public Health's capacity to contact trace is becoming increasingly difficult. The fear now is that any substantial increase in our numbers will severely compromise our ability to do any kind of meaningful contact tracing. We need both the federal and the provincial governments to assist us in helping to build our resource capacity to reduce transmission in the community and to increase our ability to conduct contact tracing. The harsh reality is that our hospitals are beginning to see more and more COVID cases and beds are beginning to fill. Any slip can lead to transmission in these settings. We also know that the data that most significant driver of COVID continues to be both the small and large private gatherings. That means we are the ones that are moving this virus. I know you're tired of COVID-19. We all are. But the only way that we can get a handle on this is by changing our own behavior. And I'm urging you again to keep your close in-person contact to just your immediate household and your essential supports. That dinner party with friends, does that really need to happen? Please postpone it for the time being. That coffee catch-up with some of your friends or your mom or dad, please take it online. If you decide to go out and eat at a restaurant or bar, please do it with just your immediate household. And with Diwali and Bandichor Divas just around the corner, I'm asking that you please keep your gatherings to just your immediate household. If you insist that your extended family must be involved, we ask that you please consider celebrating virtually or take it outdoors. By limiting your in-person contact, you are protecting your family, yourself, and the community as a whole. We're at the point where we need to crack down more aggressively on large social gatherings, both in public and in private settings. If you are concerned about something you see in the community, I ask you, please call 311. Like I said, our enforcement officers will not hesitate to fine people or businesses who think that the rules don't apply to them. Before I turn it over to Dr. Lowe, I want to provide one final update. Last week, along with Tony Frankfurter, our Chair of Tourism in Mississauga, I sent a letter to the Prime Minister and the Premier urging both to provide additional supports and immediate release of promised funds to help our small businesses here in Mississauga. This week, both levels of government have responded. The federal government announced new legislation that will extend the Canada Emergency Wage Benefit until June 2021. The legislation will also allow businesses to submit claims retroactively for the Canada Emergency Rent Subsidy for the period between September 27th and October 24th, covering a good part of the period when our businesses were in a modified Stage 2. A new lockdown support through the rent subsidy will allow businesses that are forced into lockdown to claim an additional 25% of their rent, meaning that businesses could potentially receive support of up to 90% of their rent. This new legislation not only provides immediate relief, but also ensures stronger support measures are in place in the event that we are forced into another lockdown. The province responded by providing more details on the $300 million of support promised to small business. Starting on November 16th, businesses will be able to apply for both energy and property tax rebates. I thank both the province and the federal government for listening. I encourage all businesses to apply for these supports if they're eligible to do so. We are truly at a critical moment here. We need to remain vigilant. We have a chance right here and right now to stop the second wave from overwhelming our community and from overburdening our hospitals. Our collective goal has to be avoiding another lockdown for our struggling businesses, keeping our schools open, and protecting our long-term care homes. And now, I will invite Dr. Lowe to come up and provide us with his weekly update. Dr. Lowe, over to you.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 5,494 cases of COVID-19 in Mississauga, with 353 active, 4,906 resolved, and 235 deceased. We continue to work with our provincial partners and all of you in the community to stop spread, save lives, and prevent calamity. Yesterday, the province introduced a new framework which will see the region of Peel moved into the orange restrict category that will then permit certain settings such as indoor dining and gymnasiums to reopen on Saturday. As these sectors reopen, I must be very clear. We must have a counterbalance in order to keep our current level of interaction stable or to reduce them even further. And so, let me be clear that this new framework does not change our picture in Peel. We continue to see a high daily case count and have the highest test positivity % rate in the province. All of our indicators are trending in the wrong direction. Public health capacity is increasingly being challenged because case counts are high, which means that contact tracing is more difficult. Also, too many people are not answering when we call, so please pick up if Peel Public Health is calling you. If further surges come, public health capacity may be overwhelmed, and that means our hospitals are next. Our hospital beds are also filling up, but thankfully we still have some ICU capacity for now. But it's clear that now is not the time to let down our guard. We must take strong and immediate action now. COVID-19 spreads from person to person, and it cannot spread if we do not meet. To keep everyone safe, I am recommending that you stop all non-essential in-person interactions and limit close contact to your household and essential supports. This means no private gatherings in households from people from another address as much as possible. Outside of your household, meet in person only if it is absolutely unavoidable. Work, school, healthcare, exercise, or purchasing necessities. And when you do have to meet for those reasons, be strict about the core four of distancing, masking, hand washing, and postponing or canceling if you are sick and need to self-isolate. I recognize that we all have some level of needed interaction by virtue of our lives. Your goal is to keep those contacts to that bare minimum. For everything else in person, postpone or meet virtually. For example, if you choose to do anything else in the community as they reopen, I encourage you to do so only with your immediate household or essential supports. No one else, be it dining, going to the gym, etc., if you absolutely have to. Every time and everywhere, just remember, your household is now your bubble. It's that simple. The conversation has been so focused on what can open and what can stay closed. The reality is it's more about how you're meeting than where you're meeting. Some of you have jobs where you can't work from home. That already increases your level of exposure and risk. Don't add to that risk by spending more time with others unnecessarily. Stop having wedding receptions. Stop meeting for religious celebrations or services. Stop socializing beyond your immediate household and essential supports. Meet online or meet later. The only way we can drive cases down is if we stop mixing between households. The more we mix, the more likely it is for COVID to spread. And we must do this, and I know it's been difficult. We're doing this to protect our most vulnerable, to keep this out of long-term care homes, to keep schools open, to keep this out of congregate living settings. Protective measures that have prevented and slowed spread in places this fall have worked because everyone is doing their part, and so your choices matter more than ever. We must shrink our worlds to shrink our case counts, and that will take all of us again doing the right thing. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. And now I'm pleased to take any questions from the media, or myself, or Dr. Lowe, or our fire chief for the last time.
Mayor Crombie, can you hear me? The
Yes, we
first
can.
question you have is from Angelina King from CBC News, who has a question for Dr. Lowe.
Certainly, Angelina. I'll move over. Dr. Lowe?
Thanks, Angelina. Go ahead.
Hi there. Thanks for taking the questions, and congratulations, Chief, on your retirement. I'm hoping to actually hear from both Mayor Crombie and yourself, Dr. Lowe, on this, if possible. I'm hearing from some parents at a school in Mississauga. There's 3 kindergarten classes being collapsed into 2, which will result in about 24 kids. They're concerned with the fact that this is happening given the timing of easing of modified stage 2 restrictions, and there hasn't been any COVID cases in their classroom. They're worried that there isn't enough room for distancing. I'm hoping to hear from both of you on this, including with you, Dr. Lowe. Just wondering if you're concerned with that number. How many students do you think should be in a classroom?
You know, it's a great question, Angelina. I think we've provided advice and worked very closely with the school board, and I don't think you mentioned which school board it was, but either way, we work with all 4 of our area school boards, as well as private schools and post-secondary institutions to provide our recommendations, and ultimately the decisions as to how to operationalize those decisions are taken by the school board. I certainly recognize that they are balancing a number of things on their end. There is no specific number that I would give as long as our recommendations are specifically followed around distancing, around masking, around really trying to ensure that the precautions that are put in place are done there. And I think one of the reasons why we've had such success so far in not seeing onward transmission in schools is because a lot of these precautions have been followed, in addition to cohorting, automatic dismissal, all these other steps that are meant to keep classes safe, etc. I know that there are lots of folks out there that are advancing, certain class sizes, but ultimately we provide our recommendations around the precautions that need to be taken, and it is our school board partners who will make the decisions as to how they will implement those in terms of class sizes and their operations. So I'll let Mayor Crombie answer as well.
Thank you for the question, Angelina. And I think for the most part, our schools have been quite successful and a model of what more we can be doing in the community. Certainly, we have seen their protocols. Class sizes have been collapsed. If there's a child that's sick, they are removed, and whoever they're in contact with has been removed. If worse comes to worse, the classroom is closed. But we have seen very few examples that schools are closed. And so we're hoping that the government takes the same approach to our small businesses and our restaurants out in the community. I think the schools have shown that it can work, and it can work very safely. Thank you.
Mayor Crombie, your next question is from Ashley Newport from Mississauga.
Welcome, Ashley.
Hi, Mayor Crombie.
Hi.
I wanted to talk about something that you guys were talking about earlier today at General Committee, and I think maybe Dr. Lowe might want to weigh in on this too. There's been talk about potentially prohibiting all social gatherings in Peel. I know that Quebec did do that or attempt to do that. If that were to happen, I'm actually wondering how that would even work. Is the city or the region able to pass a bylaw prohibiting private gatherings inside homes, or would the province need to sign off on this? How would this be enforced? How would this work? Is the city able to do this? Can the region do it? Does the province need to do it? How would you even begin to do something like this?
It's a great question, Ashley. So certainly always simplest when the province applies a regulation that applies province-wide. However, as we all know, circumstances are different. Hence, we have the framework where different communities, different regions are in different categories. And we are, of course, in the orange zone here in Peel. So this is something, when I asked, I'm sure you heard the response from our city solicitor, that would be best undertaken by the region of Peel because their public health is in their domain. And so we would probably pass a motion at Region Appeal supporting Dr. Lowe's guidelines. You're quite right. The difficulty is in enforcement. So we're asking our residents, if they see abundance of cars on the street, to call 311 and allow our bylaw enforcement officers to come and visit. But we're asking people to use their judgment, please. Please, things are operating well in the schools. Let's take the example of our children, for goodness sakes. Let's not get together if we don't have to. This is not the time to be booking up your social calendar. It's our social gatherings in private settings that are driving our numbers, and we have to bring them down. Yes, we've allowed businesses, small businesses, to open, our restaurants, our bars, and our gyms because they weren't the source of the spread. But social gatherings through community transmission and households are the source of our spread. So please, just take it online. Do it virtually. Have a cup of coffee with your best friend online. Don't invite your parents over. Don't invite your friends over. This is not the time for social gatherings. Dr. Lowe, perhaps you'd like to respond to Ashley as well. Thank you for the very important question.
Yes, thank you, Madam Mayor. Thank you, Ashley, for the question. Today at Mississauga Council, I issued a number of recommendations for consideration, both in respect of large and small social gatherings. You are correct that Quebec, among other jurisdictions, have started to really try to limit the nature of private gatherings that are happening in homes. Quebec is obviously the most significant example, and their picture does very closely mirror ours, which is why my recommendation has been, strong recommendation, is that people, it's strongly discouraged at this time to have private gatherings in your own private residence. British Columbia, I believe, has also recommended, or at least has made it a regulation there, that you have your home plus your safe six. We're beyond safe six here in Peel. It basically has to just be your home at this point in time. So I think to the extent that I made that recommendation, I also made a recommendation to really look at trying to postpone or discourage large wedding celebrations, large gatherings and celebrations. The reality is that the more interactions and the more people you meet, the more possibility that you're going to encounter someone with COVID, or if you have COVID, that you might be spreading it on to someone else. And we've seen time and time again that people are out there meeting. I mean, just for my own, just using myself as an example, there are friends I have not seen in a year. I have basically become a hermit in terms of doing these things, and it goes against every single fiber of my being because I'm a very social person. I actually really love meeting up with people, spending time together. That is one of the things that I know makes life worth living. But for these moments, I mean, I had a virtual party with friends watching the election results last night, and the reality is that's just the way it's going to have to be. If we want to keep this under control, and if we want to get through this with minimal impact to our schools, to our businesses, to everyone, and to really keep case counts under control. So please, I mean, my recommendation stands, and to the extent that it can be made into some form of bylaw, I recognize enforcement will be a challenge, but we have things like speed limits, we have things like other things which can't be enforced 100% of the time, but you really hope that most decent people in society will actually do the right thing and follow it. So that's essentially where that recommendation came from, and I'm sorry for the long answer, but I think I really wanted to emphasize this point. Thank you.
Next question, please.
Your next question comes from Steve Cromwell at Mississauga.com.
Hi, Steve. Welcome.
Hi, Mayor Crombie. How are you?
I'm very well, thank you.
That's good to hear. Kind of following up on Ashley's question there about Dr. Lowe's recommendations. I guess as everyone is saying, enforcement is a challenge, but my question is why do you not have the same way as the city treated as masking bylaws, where you kind of went about it yourself as a council, or perhaps even under your emergency kind of powers? Like if it is essential to kind of bring these in-person kind of meetings to a stop, like why wait until the region convenes next week or even afterwards to implement it?
So thank you for the question. We recognize enforcement is difficult, but so is smoking near a building, so is helmet wearing, seatbelt wearing, etc., walking your dog on a leash. They're all things that we do that are difficult to enforce, but we continue to do them because they're the right thing to do, and it changes behavior, frankly. So when we're telling people we're going to enforce social gatherings, we hope that it will change their behavior. The reality is we don't have the authority here at Council. We were in General Committee today. We would have to take it to Council next week, but better still it be done at the Region of Peel, because of course public health comes under the regional, their authority, Region of Peel's authority, and it is a place where we can move a motion that deals with all kinds of public health matters, including these kinds of recommendations that Dr. Lowe will make. Notwithstanding, we will start communicating these recommendations because they are best practices, and they are what we believe will help us drive our numbers back down, and certainly there will be communication vehicles out in for public consumption, from the councillors, from myself, from the Corporation of the City of Mississauga, urging people to stop gathering in groups, to limit their social gathering to their immediate family and immediate household and their essential support groups. Dr. Lowe, do you want to comment on further on why we waited today to wait for the Region of Peel, please? Steve, Dr. Lowe will comment as well. Thank you.
Yeah, thanks for the question, Steve. I think the most important thing is that I wanted to actually put forward these recommendations. I've been very clear that recognizing and understanding the desire to reopen some of the sectors, but knowing where our picture is, it is about balance. And so, while these gyms and indoor spaces, indoor dining are reopening, if we're going to possibly increase interaction and mixing on that side of the equation, then we need to address some of the other drivers of transmission. And so it's for that reason that I brought forward that recommendation. Certainly I'm willing to work and continue to work with our leaders who have frankly stepped up significantly during this time to keep the community safe, but really willing to work within their process to see how we can continue to further solidify that message, either through motions or regulations or through an ongoing communications campaign. So thank you very much for the question.
I have a question for you, another follow-up for you actually, Dr. Lowe, if that's okay?
Yep, no problem.
Go ahead, Steve, sorry.
Just a question around, you've recently been asking kind of religious ceremonies or, places of worship to move to online and virtual kind of sessions as much as possible. I'm curious, Have you chatted with faith leaders in Peel about this? And if so, what has been the kind of reception? Are they willing to do it?
Thanks, Steve, for the question. Yeah, I've heard from many faith leaders around the suggestion, and I think many of them, I want to first of all say that I recognize that faith and religious beliefs play a large part of the lives of many people in the region of Peel, and you know, certainly it's not an easy recommendation that I make. It's certainly not made in a cavalier manner, but there is clear data and evidence that we've had that many religious celebrations, gatherings, prayer meetings, we are seeing outbreaks and exposures in these instances. And so it's for that reason, as we start to see cases rise in our community, first of all, there's an increased risk with any of these gatherings, which I am speaking to in that recommendation. And second of all, it's also about not just the risk specific to that community, but the broader risk of transmission, especially as other settings are starting to reopen as of Saturday. So I've certainly heard from many religious, and obviously the opinions are across the spectrum. But my recommendation still stands. It's about really just trying to keep our community safe, keep their groups and their congregations safe, and hopefully managing to get this back to a point where we can confidently retract that recommendation. Thanks, Steve.
The next question is from Isaac Callan at the Pointer.
Hi.
Isaac, go ahead.
Hi, Isaac.
Hi, can I speak to Dr. Lowe, please?
You sure can. Thank you.
Thank
He's
you very
coming now.
much.
No problem.
Sorry, Madam Mayor. All right, Isaac, go ahead.
Hi, Dr. Lowe. You've honestly covered a lot of my preamble in your comments so far. You've hit on things like the highest test positivity rate in Ontario, the fact that all the metrics, as you said, are going in the wrong direction. And then in your answers to Steve there, you've said that, settings like bars and restaurants will be reopening on Saturday. So my question is simply why? What about the viral picture in Peel right now says that is a good idea?
Isaac, I think I've made it very clear that I do not support the unrestricted opening of bars and restaurants. And so it's for that reason that I'm making my clear recommendations. If these settings, as I understand it, for whatever reasons that the province has decided are to reopen in my community, then I have provided a number of recommendations of other transmission drivers that need to be addressed in order to bring this, in order to maintain, at the very least, hold and hopefully drive things down. So I want to be very clear that an unrestricted opening on this side with the bars and restaurants without me making my clear recommendations around social gatherings, workplaces, household transmission, that is the counterbalance. This balance is absolutely essential, because I think if I'm not going out there with these recommendations and the further actions that might be taken to limit them, then yes, I would have questions around the decision that was recently taken. But I have the support of our mayors that we are going to move forward with some of the recommendations, as I understand it, around social gatherings. And my hope is that this will continue to address other drivers of transmission in the community, even as these settings are to reopen. Do you have any?
If you take the example of Toronto just to the east, and I'm not asking about Toronto's viral picture, more the precedent they set. They have delayed for a week. They'll be in a control or a modified stage 2 for a week longer. Mm-hmm. You have that power to say, put 2 weeks. You've said before the virus, the 2-week cycle. You could put a hold on these measures for 2 weeks, and then we wouldn't be talking about, Mayor Crombie has talked about speeding and how that's difficult to enforce. You mentioned something similar. I think the messaging, it's getting very confused, balancing reopening restaurants with other changes. Why are we not just putting the brakes on, taking 2 weeks and seeing where the measures are, and then going ahead with those reopenings after that in a similar manner to what Toronto is doing?
I think I've made it very clear that, certainly in the region of Peel, what I recommend is that we really make sure that we are taking all the measures that are needed in order to counterbalance what has been put forward by the province. And so I think, I don't have the power, just making it very clear, to delay this. I certainly have put forward my recommendations to the Chief Medical Officer of Health ahead of the announcement that was made yesterday. But ultimately, the decision is being taken at the provincial level, and I think you would need to ask them as to the questions on the specific timing. But I mean,
before I'm cut off, is that if you don't have that power, would you like to ask them for that power now? Would you like to ask the province to delay Peel for another 2 weeks? Even if you don't have the power, you could say that right now.
Isaac, I think it's really important for me to continue to be working as a good partner with our provincial colleagues who share similar goals to us in terms of controlling this disease. And so, just to be very clear, I have made very strong recommendations that I think are needed and need to be acted on in order to address the reopening that is coming on Saturday. That's where we're at right now. And that's where I'm really hoping that as this moves forward, all of us in our community will continue to take the steps that they need that all of us need to be taking to make sure that this stays under control. Thank you for the questions.
Dr. Lowe, you have a question from Khaled at My Second Home TV, followed by one from Mayor Crombie. Khaled, go ahead.
Thank you. Dr. Lowe, how are you?
I'm doing very well, Khaled. Thank you.
Great, thank you so much. Dr. Lowe, with the COVID testing full swing, and you may also heard the Premier today about the full capacity. What is the turnout time between taking or making the test and having the results?
Thanks, Khaled, for the question. I don't have the specific number off the top of my head, but we do report the percentage of tests that are returned within 1 and 2 days on our weekly epidemiologic summary. So you can visit peelregion.ca/coronavirus, look at our case dashboard, and if you click on weekly epidemiologic summaries around page 6 or 7, there will usually be the dashboard indicators, which will include what percentage of tests are returning within the specified standard and time frame that the province has set forth. That's a measure of how well our provincial partners and agencies are able to return test results to us in public health. So thanks for the question.
Thank you.
Khaled, your question for Mayor Crombie.
Sure.
Khaled, just before you, I just wanted to comment to Isaac, if he's still around. I didn't get a chance to respond, but 3% of our transmission is in our restaurants and in our gyms in Peel. City of Toronto is 27%. You have to understand that circumstances are different. The cause of the spread of the virus differs in each region. Ours more similar to Ottawa, hence they were opened, we were opened. Notwithstanding that, we understand counterbalances have to be put in place. Other measures have to be put in place to prevent the spread from where it is occurring, which of course is in the community and in households. So hence why we're reducing the opportunity for interaction in private settings. We're trying to bring down community spread. So Isaac, I hope that helps. So circumstances differ in each region, and hence why Toronto is not opening restaurants and bars and gyms for another week, whereas we are here in Peel and in Ottawa as well. Khaled, sorry to interrupt you. I just wanted to make that point. When you look at the modeling, the answers are right there. But Dr. Lowe is quite correct. We need the counterbalance to address the situation that occurs in Peel.
Really appreciate it. Before I ask your question, if I may have an additional question to Chief Packett.
Sure. Yes, I think he would like that, of course, Khaled.
So much. So my question to you is, today the city committee issued something about the new bylaw for short-term accommodation.
That's correct.
Can you please elaborate and why in this time, what happened?
Oh, so certainly we put forward a framework which will allow, we call them STAs, short-term accommodations, and we have different rules in Mississauga that will apply that differ from other regions. They're all slightly different. We were encouraging the province to put forward a guideline that would enforce short-term accommodation guidelines right across the province, but since they haven't done so, each city, each municipality has done so on their own. And for Mississauga, you have to register that you're prepared to rent out your room in your home or your home. There's a registration fee of $250. It must be your primary residence, and you cannot rent it out for more than 30 days. It's an under 30-day period. So it's the framework that was established going forward, Khaled.
And that will affect also Airbnb, right?
That is considered a short-term accommodation rental, correct. We just wanted to generalize because there is more than just one company, that Airbnb, that operates in Mississauga or across the GTA, frankly. As you know, many of them, bookings.com, hotel.com, many of them exist, so not just the one. So we call them short-term accommodations. We don't make it specific to Uber. We don't make it specific to Airbnb.
Really appreciate it. Thank you so much.
And
Mayor.
over to Chief Beckett, please.
Yes.
And so your final question at the final press conference, Chief, over to you.
Thank you.
Go ahead.
Chief Beckett, congratulations first and enjoy to the maximum. And my question is, we remember a Hickory explosion like 4 or 5 years ago. And can you please share a little bit how you managed to put the pieces together at the time and whether this explosion introduced a new procedure in your operations?
Thank you for the question. So the Hickory house explosion was probably one of the most memorable events that in my entire 35-year career. Definitely one that was challenging, and not just so much from the explosion itself, the operations side of things, but the complexity of the entire emergency. Dealing with the number of people involved, the number of agencies that were coming in, working alongside and closely with the mayor and members of council. Councillor Fonseca was in her ward. Definitely a memorable event, one that was truly a team effort. I can tell you that we had just finished a number of training exercises over the last couple of days and actually had just left the training center on emergency management procedures when that call came in. So everything was fresh in our minds and we were able to put the plan into place. Definitely a memorable occasion. We took the Hickory Drive explosion, and what we did was we took our lessons learned from that, and we're able to apply those lessons learned when we had the Huron, Ontario explosion that happened about 18 months later. And it made that incident much easier to manage because of the lessons learned. So thank you for the question. I'd just like to maybe finish off while I'm at the podium by extending my gratitude to the citizens of Mississauga. It's been an honor, it's been a privilege, and it's been very humble to serve you. I want to thank the Mayor and Council. Madam Mayor, you've been a big supporter of the fire service. Council has been a big supporter of the fire service. We've accomplished a lot in my 6.5 years here. We didn't get everything done that we needed to do, but it's an opportunity now for somebody to come in and carry on what we've started and make it even better than where I'm leaving it. So thank you, everybody.
That concludes the press conference for today. I thank everyone for joining, and we'll see you next week.
Thank you. Thank you, Chief. Thank you, Dr. Lowe. Thank you all for joining us. I'm glad you got a question in, Chief.